Now, there's an uneasy feeling amongst nurses in the healthcare system across the country as COVID-19 infections continue to rise. Nurses are demotivated, they feel rejected as they've had to deal with a lack of resources and increasing number of patients. We're going to take a countrywide look at how the second wave of COVID-19 is affecting all aspects of living in South Africa. And I'll just introduce all our reporters. We have our ENCA reporter in Gauteng, Manqoba Mqunu. And Nobisutu Hejane is, of course, going to give us an update from Cape Town, which is another area really badly affected by the second wave. Mawande Keswa is in Durban, and he's going to update us on the rapidly rising numbers in KwaZulu-Natal. And then over in Limpopo, we have Siphamandla Goge. And what's interesting about Limpopo, of course, is there are real concerns that as people stream home and head back to families in that area, a province that hasn't been too badly affected could see a spiking numbers. But let's start in Gauteng with Manqoba. Now, healthcare workers are really fearing the worst in Gauteng. Numbers have spiked. Manqoba, tell us what is the latest.
Indeed, Sally, many of the healthcare workers that we spoke to earlier on saying that they fear for their safety. Many of them saying that they feel that the Gauteng Health Department is simply not ready, Sally, to deal with the second wave of infection, given the fact that there are still issues that are still there concerning the issue of PPEs, the issue of overstaffing, as well as issues of overcrowding at some of the hospitals in the province. So we did speak earlier on to the General Secretary of the Young Nurses Indaba Trade Union, who says that many of the nurses are quite frustrated, many are demotivated, and also they're stretched to capacity because they've had to firstly deal with the first wave of infections, and now they are now confronted with this new second wave, which of course is much more difficult given the fact that it has a new variant of the virus that is currently haven't been discovered. So many of them sadly saying that they simply don't believe that they have all that they need in order to do their jobs and to ensure that they save lives, given the fact that next month, as early as next month, we could see some of those holidays makers coming back to Gauteng. So there are quite a lot of concerns that when that happens, we could see the numbers spike up even further, and that these nurses saying that they simply won't be able to cope with the situation. Take a listen to what Zola Sapeta, who is NEHAWU's General Secretary, had to say about this.
Yes, across the country, there's a general fear, precisely because, particularly after the study that had exposed the quality of KN95, which is not equal to the standard, and also having had the new variant as announced by the minister 3 days ago. So that worries them, given their experiences of what have been handled and subjected to the conditions that are not protecting them from the first wave. So now things are really tough, and we see numbers growing. We see both in terms of the new infection and also in terms of deaths. So, of course, they'll be worried because there are no material changes from the behavior and the conduct that government did in the first wave. So,
all right, so healthcare workers in Gauteng are worried, Manqoba. Is there a plan to deal with the second wave? And as you explained, it may hit a little later as holidaymakers return to Gauteng.
Well, Sally, what government is saying is that there is a resurgence mitigation plan that they have in place to deal with issues of the second wave. Of course, we did try to reach out to the health department to speak to the MEC about what exactly that plan entails, but were unable to do so simply because they said that they were not available to speak to us today. But they did speak, however, to ENCA about 2 weeks ago to one of my colleagues in Nkosazana Tambuza, where the MEC did express the fact that they have that resurgent plan, and part of the plan is that it entails that they'll have over 2,000 beds that have been set up in all public hospitals, and these are really going to be used to deal with this second wave of infections. But of course, there have also been quite a number of concerns that have been raised, Sally, regarding the reporting of those COVID numbers here in Gauteng, with the province coming under fire last month for inaccurately reporting some of those numbers, and some of the health experts saying that this could well hamper some of those interventions that government wants to put in place to deal with COVID-19. And of course, the DA sharing the same sentiment, saying that they believe that these numbers, if they're reported accurately, could spell disaster. Take a listen to what Jack Bloom, who's the DA Shadow MEC for Health in Gauteng, had to say.
Must be honest, the figures that we're given, I'm not sure are trustworthy. There was a period when the number of active cases was lower than the number of people in hospitals, and it's only recently that they've started again giving us a district breakdown. So I think we need to have confidence in the figures to start off with, because if you can't track this epidemic, we need to know, is there a resurgence in this part of the province, in another part of the province, and then we need to also crack down on the super spreader events. I think that's the key thing. I think outdoor activities are much less problematic. It's indoor activities, people in close proximity to each other. And I think the big test is going to come in January, when people come back from their holidays from the coast. And we know that there's been an upsurge in the coastal areas. I think the big worry is when they all come back to Gauteng, and, are we prepared to accommodate the influx of new cases?
Of course, that's the DA's Jack Bloom. Thank you very much for that reporting on the situation here in Gauteng, our reporter Mangoba Mkunu. Let's head now to the Western Cape, of course, leading the surge, the second wave of COVID-19. Nobisuthi Jana, thanks so much for joining us. So you have been assessing where we are at. It's really difficult at the hospitals. They really are under huge pressure, and not just along the garden route, I understand.
Certainly, Sally. Now, according to the department's Dr. Karim, he did say that about 11 private hospitals and 2 public hospitals have asked for a diversion. Now, he's saying that these are causing a severe strain to healthcare practitioners at hospitals, as well as the operations that need to be carried out in hospitals. About 79% of the Cape Metro hospitals, as well as the 89 of the rural hospitals in the Western Cape are struggling to actually operate due to these increasing cases of coronavirus. Dr. Karim did also saying that as the department, they are worried and concerned about the second wave, especially now that we are in the festive season and people will be attending those large events where there will be large gatherings, and also people traveling from the Eastern Cape back into the province and other provinces. But it did say that although they will not be reopening some of the fields hospitals that we had during the first wave, but they will be using the same strategy to try and, enforce, or rather tackle, the second wave that we are dealing with. We also did speak to a number of unions that are representing nurses in the Western Cape, and they also raised the issue of nurses being exhausted and scared to actually work, because they are putting their lives there and assisting people, and they're also now pleading to the public to actually help them in decreasing these numbers, to sort of level down the cases that, or rather patients that are admitted to hospitals.
So it's really difficult. The Western Cape, if we look at the active case number, the Western Cape is leading with 34,000, more than 34,000 active cases. But we know at the same time that the government there, the DA government that runs the province, is actually moving to try and get beaches reopened along the garden route. Are they still adamant that that is something they want to do, given the high infection numbers in their province?
Well, Sally, if you look at social media, especially with the interview that I did with Dr. Karim, a lot of people were actually raising that concern. Why is it that the province is pushing for the beaches to remain open while we have this problem, where now the health facility is struggling to cope with the rising numbers, or the spike in the number of COVID cases. But the city of Cape Town, or rather the Western Cape, is still adamant that they have to protect the economy, and ensuring that they welcome travelers into the garden route, into the Western Cape, to enjoy some of their their favorite festivities, but there is a concern from the Department of Health that come January we will have a problem.
Absolutely. Well, thank you very much. That's Nobusutu Hejane coming to us from Cape Town. Western Cape has over 34,000 active infections, and that is followed in second place for active infections by the province of KwaZulu-Natal, over 29,000 active infections. Interestingly, Gauteng is third with over 15,000. The Eastern Cape seems to be possibly over its peak. They've got 13,000 cases. But let's focus now on KwaZulu-Natal, and I'm joined by my colleague Mawande Keswe. Mawande, thank you very much for joining us. So the situation in KZN is that the beaches are open. They're only closing on certain traditional big beach days. What is the situation with the hospitals? Because it seems as soon as hospitals can no longer cope, the chances of someone dying because they just can't get help increase massively, and that is one reason to close beaches, because it keeps people away from those tourist hotspots. So how are the hospitals in KZN looking?
Well, to date we've recorded over 157,000 positive cases. Now, this is in combination with the over 2,000 cases that we've been recording per day on average in the province. This has translated to quite a number of people needing medical assistance within the hospitals themselves, coupled with the normal incidents or the daily incidents that we do face. We've got some that are emanating from crime, some are emanating from road accidents and fatalities. So you'll find a situation where there's much more pressure on the health system with regards to a higher number of people needing medical assistance. This has put hospitals in quite a precarious position, in the sense that some of them have had situations where they were not able to admit any people inside the hospitals, and that has put the system under pressure. We did get a chance to speak to the health MEC, Nomakukusmila Nezulu, and this is what she had to say.
We are quite ready for the second wave. We are ready in relation to the bed availability as well. We currently have more than 3,000 beds available. Remember, when we were first hit by COVID-19, we had to repurpose some of the facilities that we have, and that was an investment that is permanent within our own facilities all over the province. We had to put up, or we did put up 4 what we call field hospitals. One is in King Kechwayo, which is in Gwelizane Hospital. The other one is in General Kizenga Mpanza Hospital, which is in Ilembe. And the other 2 are in Clearwood Hospital, eThekwini. Now, of the 2 that are in eThekwini, we get more than 220 beds out of that, and 113 in each of the other ones that I've counted.
Right, so the health MEC has a clear plan, and she seems fairly certain of how it's all going to work. How positive are healthcare workers in the province of KwaZulu-Natal? How are they doing?
Well, healthcare workers say that they are facing quite a task. There's much more pressure on them, as they have been throughout the year. Paramedics also coming in and saying that they're working long hours as a result of the higher demand, and there is quite a level of unhappiness when it comes to the union, which represents a number of those healthcare workers, saying that they are overworked and that they do not even have the correct or quality PPE equipment, as they would say. We did speak to paramedics as well as the union, and this is what they had to say.
We have received reports from our members that there have been a huge influx in the past few days of the patients that are admitted, and that is going to increase the burden on our members.
It certainly seems from that bite that the pressure is now starting to ramp up on KZN hospitals. You said you'd spoken to paramedics as well. I know we have a clip. Just set that clip up for us.
For numerous reasons. Obviously, the call volumes are excessive, and obviously we're making sure that our staff have all the correct PPE. They have obviously added vitamins, all necessary precautions, fogging machines, whatever's needed.
Yeah, I wonder that paramedic making the point that you made earlier about that triple whammy. They've got road safety issues, they've got traffic accidents, and they've got crime and that sort of thing, all sort of coming together at this time. Is there any talk of KwaZulu-Natal beaches perhaps having to close completely, as we're seeing in the Western Cape, parts of the Western Cape and the whole of the Eastern Cape?
Well, what we do know at this point in time is that when the president made that announcement, there was a bit of confusion in terms of how it would play out. Initially, it was said that on those specific days, the beach would close completely. People wouldn't even be able to walk on the promenade. However, it then became a situation around where the promenade is open on those particular days for people to attend, days like the 25th, the 26th, but it's open for people. The promenade, people can walk, they can jog. Ushaga Marine World was also open. However, now it has subsequently been closed. However, the promenade remains open even on those days. So at this point in time, it's not clear as to whether or not there will be a total shutdown of the beach. However, the decision to do so, to close the beaches completely, would be a decision that would not be taken lightly, considering the fact that when we did speak to the mayor of eThekwini, he said that the promenade plays a huge role in terms of the people that have come to the province and what they are here to bring with them. So they're hoping that opening the promenade would relate to some economic cushion in terms of people being able to make money, the vendors that work on the beach, and all the other businesses that rely on that. So if there were to be a total closure, it's worth noting that all of those people would be affected, and they have been affected throughout the year. So only time at this point will tell us what will transpire on those days where the beach is said to be closed completely.